So we're going to go over the essentials of a integumentary system assessment, and typically included in that it's hair, skin, and nails all together. It's a lot of inspection, as you'll kind of see. So we'll want to, again, talk to our patient, introduce ourselves, do a general safety check, and explain to them then what we're going to be doing. So I'm just going to be looking at your skin today, Justin. And you can just start with the face inspection, looking at color, lesions, any sort of rash patterns. And you can, at this point, if you want to palpate or feel through their hair, depending on the situation, you may want to wear gloves for that, feeling for any sort of lumps or masses. Then we're going to ask you, we'll just undo your gown if that's okay. And we're going to look at the skin on your upper body, so we'll keep you covered here. So again, we're looking at the color. You can lightly palpate with the dorsum of your hand for temperature, warm and equal. It's got normal hair distribution, no obvious rashes or lesions. We go down to the nails, and we're going to note any clubbing that we see, no clubbing, no discolorations. We can check cap refill here. Good, it's less than 2 seconds. And then same on the other side. So we're looking always for symmetry as we move down. And again, any lesions or areas of erythema potentially from pressure, which we'll get to more on the back side. But you could also note maybe areas here, like for example, if the person is bedridden, on their elbows. And actually, this is sort of an example of Justin was probably just leaning on his elbow a little bit. So it's a little bit of a reddened area here. This is called erythema. And if we press on it, it blanches, so it turns white and then it turns back to red, so that's blanchable erythema. That's a little less of an ominous sign. That means that there has been pressure there, but if it's non-blanchable erythema, that's actually technically the starting of a stage 1 pressure ulcer. So we'd want to note, especially in those bony prominences that we can access, like for example the elbows, and we'll get him to turn and we can look at the ones on the back because there's a couple more there. We'll just cover you up again here, sorry. And you could use the blanket for this too, or a gown, whichever is more comfortable for the patient. And we're going to move down to the lower extremities. Same thing, looking at color, warmth, circulation, lesions, hair distribution, any sort of wounds, rashes. At this point, you could also note swelling or edema, and we can check cap refill to your toes. Your feet are warm. Good hair distribution. So at this point, we've sort of looked anteriorly at our patient's skin. Now I'll maybe ask you to roll onto your side and face the wall if you can. Of course, if you needed help, they needed help to do this, you get another person to sort of help guide them or move them or hold them on that side. But now we're going to look at those pressure points. So if the person is in bed for extended periods of time, they're at risk to have pressure ulcers starting even or happening in their hair at the back of the occiput of their head. So you do always want to check that, especially with people with darker hair. It often gets missed, or thicker hair even, missed or not seen. So you kind of want to look there. Sometimes the ears can have lesions on them. Say they're wearing oxygen, you want to check behind the ears that oxygen tubing isn't creating any sort of areas of pressure and skin breakdown. We'll look at the shoulders, so where the shoulder blades are touching the bed potentially, and moving down the spine. Some people, even their spine, if they're a very thin or emaciated person, their spine can be an area of pressure on the bed. The hips, we would look, we won't get our partners to do this in lab, but you'd want to look at your patient's coccyx and sacral area, because as you know, that is a big pressure spot when the person is laying in certain positions in bed, if the head is tilted, or in a chair too. Same with the ischial tuberosities. So again, if the person is sitting in a chair, these are areas where you will potentially see pressure points. So you'd want to make sure that that's not progressing or happening. If the person's side lying a lot, we could check where their knees touch too. So you could check here and maybe place a pillow here between their knees and their heels so they're not rubbing there. Another potential area is the backs of the heels. So again, checking that blanchable redness, making sure they're not boggy or discolored heels, that maybe we need to do some better pressure relieving of these areas. So those are sort of the main spots that we are checking for pressure, but also again, we're doing that general inspection of hair distribution, color, warmth, rashes, lesions, talking about moles, mole changes, any eczema they've noticed, or apparent allergies that are coming across in skin, or if they're having pruritus, those sorts of things. So it's sort of a basic, a lot of it is inspection and light palpation for skin, but you really do want to get into those areas and focus in on those certain areas that are sometimes hard to see. But yeah, thanks, Justin. That's good. We'll put here.